Hello, my name is Dr. Anamika Joshi. I'm an oculoplasty consultant. That means I'm an eye plastic surgeon. And today I'm going to talk about an important question that my patients ask me, that is artificial eye surgery permanent? So what is artificial eye surgery? Artificial eye surgery is done basically for patients who have lost their vision completely and their eye also looks very disfigured and spoils the appearance of the entire face. Artificial eye surgery cannot bring the vision back, but it restores the cosmesis and therefore the overall appearance of the face. So what do we do in this surgery? There are basically two main steps. One is the surgery and second is the making of the prosthesis. Now surgery is called evisceration surgery, in which we basically put an implant to kind of increase the volume on which the prosthesis is going to sit. So this surgery, evisceration with implant surgery, involves removing of the intraocular contents of the eye which have got spoiled and putting an implant inside the cover of the eye so that it gives enough support for the prosthesis. Now, prosthesis is not placed during surgery. Prosthesis is placed 1 month after surgery. And it is not placed by any surgery. It can just be instilled normally by the patient. So this is done 1 month post the surgery. Prosthesis is nothing but it is a material which is made by matching the other eye, color matching it, measuring your size and shape of your socket, and then we kind of place this prosthesis. So this prosthesis can easily be worn by the patient. Now the first part, that is the surgery, is permanent. That means full life, you don't need to repeat this surgery again. But the prosthesis, it's like a shoe, right? Like the way you wear your shoe, you're wearing the prosthesis. So this has to be changed after 10 years. Why? Because your size and shape and color of the eye also changes. And if you keep using the same prosthesis for so many years, then there is a chance that the surface of the prosthesis can become little rough and they can irritate your socket, right? So prosthesis has to be changed after 10 years. And for maintenance of the prosthesis, just like how you polish your shoe, you can polish your prosthesis every year. Polishing is a very simple process in which your ocularis will just smoothen the surface of the prosthesis so that you can continue to use it without any issues. So artificial eye surgery is permanent, but prosthesis should be changed after 10 years, right? So I hope I've answered your question, and it's a very good surgery. Patients feel really happy once they offer this surgery. The entire appearance of the face and the eye changes, and if you have disfigured blind eye and if you're thinking about it, you could definitely consult an oculoplasty consultant, or you can contact me. I also offer online video consultations, and I keep posting about this surgery on my Instagram page as well, where you could follow me. So I hope this helps. Thank you very much.